So how do local numbers look right now when it comes to COVID?
Yeah, so unfortunately, we continue to see some growth in the number of patients admitted with COVID-19 to our hospitals. In northeastern Wisconsin, we have 78 patients admitted in our hospitals, which is about a 20% growth over this time last week. And in the Fox Valley, we have 87 patients who are admitted down there, which is a 28% increase from last week. So our increase rate maybe has slowed just a little bit, but we continue to see strong growth in those numbers, and it's something that we really need to continue to take an eye on and do something about it.
Can you tell us about a COVID treatment for high-risk individuals?
Right, so there's certain patients who are at high risk for progression to a more serious form of COVID-19 that can be given to patients early in their course. This was, sort of made popular by President Trump last year when he had COVID-19, where he received that infusion of monoclonal antibodies. So many patients are eligible for this. It seems to decrease the likelihood that people might progress to a more serious form of COVID-19 where they end up in the hospital. But again, it needs to be given early in the course. And essentially, it's an infusion of antibodies, which is otherwise the same thing that the vaccine gives to you when your body makes your own antibodies. But it is something that's out there. So if someone's high risk, it would be encouraged to get tested early in your course of illness and talk with your doctor about whether or not you're a candidate for that medication.
Are people relying on that treatment and not getting the vaccine?
That's a great question. So you're eligible for it whether or not you're vaccinated. Just from our experience, it seems that most people at this point who are getting sick with COVID-19 are unvaccinated. So more commonly, they're probably the ones getting the infusion. But both people, either vaccinated or not vaccinated, would be a candidate for it should they catch COVID-19.
So it's a big day for many families in our area as kids head back to school. What should parents, students, and staff be doing to stay safe this year?
Right. So, probably first and foremost, if your kid is sick, seems to have bad allergies, has a sinus infection, we give a strong recommendation that they not attend school and should be tested for COVID-19. We see that in both adults and kids who feel like maybe their allergies are acting up a little bit. They ended up going to work and exposing potentially, many different people and end up being in the emergency department where they test positive for COVID-19. So that's a clear strategy where we need to help prevent spreading to other people. Of course, masking is a very strong recommendation from healthcare folks, washing hands, and then trying to distance where you can. So it's that public health stuff that we've been practicing since way back in early 2020 at this point that we need to do to keep kids in school and keep everyone as well as possible.
Yeah, that masking policy in schools is a hot topic. Some schools are requiring masks while indoors. How long do you think those rules could be in place?
Certainly our trajectory at this point is still on the upswing. I don't know when we're going to peak at our maximum number of people in our hospitals in our region. I think those strong public health measures are going to be in place until we see numbers start to decrease again. This summer we had pretty darn low numbers for a period of time, and a lot of people got to enjoy not wearing a mask, when you went to the grocery store or went out in public where it was really safe to do so. But clearly we are not in that position right now where not masking is a responsible idea.
In Wisconsin, Doctor, more than 54% of residents have received at least one dose of the vaccine. Why do you think the numbers are starting to increase now?
I think there's probably two main reasons for that. The first is that the Pfizer vaccine now has full FDA approval. We know about a quarter of those individuals who are not vaccinated so far were essentially waiting for full approval before they would move forward with accepting the vaccine at this point. So we've seen patients who have been waiting for that and now are ready for vaccination. And number two is that we have, a high number of people infected with COVID-19, and people are realizing that the time is now to get vaccinated to help their entire community with this pandemic.
Let's talk about the booster shot, that third dose. A lot of people will be, or some people will be starting to get that. When should people get the booster, and what's the best way, the best place to get that shot?
So at Bellin Health, we're reaching out to our patients now, most commonly via the MyChart app, if people have that on their phone, to let them know when they're a candidate to get that booster shot. Right now, we're mainly looking at people who have a high-risk medical condition, which represents maybe 3% of the population, who are at least 1 month out from their full vaccination or their second dose with the Pfizer vaccine, and those or Moderna, and those people are going to be eligible now. We expect later in September, probably around the 20th of this month, additional individuals will be eligible who are not necessarily high risk, but who are somewhere probably 8 months after they've received their second shot of either the Pfizer or Moderna vaccine. So people should stay tuned, download that MyChart app if you haven't already, because that's going to be the easiest way to get that scheduled and get that information when the time is ready for you to get vaccinated.
Okay. Now, with fall inching closer, concerns about the flu season are ramping up. Take a listen.
I don't think it would be valid at this time to try to predict exactly what's going to happen, because so much depends upon what happens between now and December with regard to human behavior.
Dr. Burmeister, are you worried about the flu and COVID colliding?
You know, I think it's always a concern that we have. Our entire health systems are working really hard right now to help with the COVID pandemic, and an additional stress on our system really could make things extraordinarily challenging for us beyond what we're already experiencing. But, you know, again, with influenza, we have things that we can control that are going to help how we battle the influenza, season. And that's going to be having a good number of people vaccinated against influenza here in the coming weeks and months. And then again, just like they mentioned, those behaviors like wearing a mask and distancing also, like we saw last year, can have a significant impact on the number of cases of influenza that we experience. So things are in our control, and we just need to, talk about influenza vaccine here probably shortly.
And what advice do you have for people who are hoping to hit the road over Labor Day?
Right. So as you said when we opened this piece here today, if you're not vaccinated, it is recommended that you don't travel at this point. If you are fully vaccinated, then you should continue to use those public health measures of masking, washing your hands. And if you get sick, please don't go out into public around other people and potentially expose others. So, maybe just be aggressive with that testing right now. It's really easy to do. There's typically no cost for the patient to get a COVID test at this point. So just do what you can and be a responsible member of our society.